Good evening and welcome to the Second District Health and Wellness webinar. I am your host, the immediate past. That's right, there's no past like immediate past. Brother Kelvin Ampofo, immediate past district representative of the Second District, and I'll be your host this evening as we go through our monthly webinar series. Want to thank all of our viewers, our supporters, brothers that always continue to watch and get this uplifting information from our brothers, our doctors in the community. As always, all of the information that you hear on tonight, it is the opinions of the doctors of their own opinions. So I just want to be clear. The views do not reflect the Omega Psi Phi Fraternity or any of the businesses that these doctors may be affiliated with. So with that being said, let us get started. Let me introduce to all of you all the Second District Health and Wellness Chairman, our good friend, we call him 88, Dr. Jedan Phillips. Dr. Phillips, is always good to see you. Good evening, my brother.
Hey, good evening, brother. Immediate pass.
Take us away.
How are you doing this evening? Good to see you, my brother.
Outstanding, absolutely.
Good evening, folks. It's exciting to see you guys here again today for another important conversation about preventive health. This month is Heart Health Month, and we're going to be talking about cardiovascular health tonight. So I'm excited for what we have in store as far as our conversation. And again, I encourage all of you to stay tuned with us for every month, the fourth Wednesday, when we have our monthly webinar showcasing our Second District Health and Wellness Committee members. So with that, I'm excited. Let's go. Let's get it going, bro.
Outstanding. Thanks as always, Dr. Phillips. So let's introduce our first doctor. We call him 78. 88 actually calls him our spear. Dr. Boykin certainly has been with us again since the beginning, and we just want to continue to uplift the community. Dr. Boykin, good evening to you, my doctor.
Good evening, and thanks everyone for being here. I say to you, Aquaba, in the language of the continent that I learned when I was there in October. Very exciting topic we're going to talk about tonight. And just because you think about heart disease in adults, there's some things that happen in the pediatric world that can reflect on the adult world and heart disease. And also there's some heart disease that runs in children. So I want you to sit back and take notes because some very, very interesting and a wealth of information can be given tonight. And again, I say to you, Aquaba.
Aquaba as well, my brother. Thank you so much. As we are celebrating, obviously, Black History Month, we certainly celebrating our ancestors. And so now we want to introduce our next doctor that we call 92, also from the 70s, Dr. Wingfield. We're going to hear a lot from this doctor tonight, but good evening to you, my brother. Just make sure you come off mute so we can hear all the great things you tell us. How you doing, Doc?
Hey, great. Good evening, everyone. This is certainly a privilege and an honor to be here this evening to discuss heart health. We've been doing this on a monthly basis, and it's been outstanding. So I'm very excited about discussing heart health, increasing awareness. As we're all aware, February is Heart Month. Heart disease has been the number one killer in the United States and throughout the world since 1900. The only year that heart disease was not the number one killer was 1918 when the Spanish flu. So we've been battling heart disease for the past, 100 plus years. Very excited to discuss heart disease, increase awareness, because, when you look at the numbers, every 34 seconds, someone suffers a heart attack. Every 84 seconds, someone dies from a heart attack. So it's extremely important that we discuss heart disease and we increase our awareness. So I'm looking forward to enlightening us all and having an excellent exchange of ideas and information. So
Outstanding. Thank you so much, Dr. Wingfield. Next up, we got 95, Dr. Isabell. Good evening to you, good brother.
Good evening. Happy to be here. Dr. Lee, Isabell Internal Medicine. I do outpatient primary care as well as inpatient care, board certified internal medicine. And heart disease has affected the Black community. A lot of people don't know that until they have an episode. And we're happy to be here. Thank you.
Dr. Isabell, thank you so much for your introduction. And last and certainly not least, 9-6 holding it down. Always we have to represent for the ladies. And so Dr. Plummer is here to make sure that all of the good and all of the great information that's shared on tonight, we don't forget, we don't forsake our ladies. So Dr. Plummer, good evening to you, good brother.
Good evening, everyone. My name is Dr. Plummer. I'm board certified in OBGYN and in maternal fetal medicine. I specialize in high-risk pregnancies. And today I'm glad to be sitting around talking with my colleagues about heart disease, which is the #1 killer of women in the United States. And sit back and just take in all the information. And as we emphasize, prevention, prevention, prevention. Thank you.
Outstanding, Dr. Plummer. As always, we appreciate you. I want to thank all of the doctors, and certainly under the leadership of our 2nd District Representative, Brother Del Rico Gales, who certainly has got a time, running the district, but certainly allowing this committee to move forward, and certainly under the leadership of Dr. Jedan Phillips. I just want to thank all of you all for continuing to make sure that we uplift our community. So, with that being said, Dr. Wingfield, I think the topic of the month is something that's obviously near and dear to you, no point intended. Please take us away as we talk about this most critical subject for this month of February.
Right. So thanks a lot for that. I will just begin in terms of my background. I am an interventional cardiologist. I practice at Robert Wood Johnson University Hospital in Hamilton. I am the chairman of the Department of Cardiology for the past 7 years. And one of the most critical aspects of heart disease is obviously education and awareness. We're all taught that doctor in Latin means teacher. So it is extremely important that we bring messages to the community. And then, on top of that, one thing that I tend to deal with is referrals from different specialists, as well as from new patients, because since the COVID outbreak, one thing that COVID showed us is that the number of comorbidities or medical conditions that you may have can predict your overall outcome. And we saw that firsthand with COVID. Very similar with heart disease. So it is extremely important that as I see a patient as a new patient, or if I see a referral, that we start to take a look at those risk factors, those factors that are important in predicting your overall risk of heart disease. Okay. So in addition to taking a look at those risk factors, there are also more extensive risk factors that specifically affect the African-American community that we want to be more and more aware about. And so that's what we'll begin to discuss.
Thanks, Dr. Wingfield. I wonder if you could elaborate just for a little bit, because you mentioned African-American community. So obviously that makes up a majority of our viewers. Could you elaborate just a little bit more on the African-American communities?
Yeah. So when we look at the numbers, right, just in terms of the African-American community, there's several factors involved in heart disease. Whether it's hypertension, which is, we call it the silent killer. So hypertension typically goes untreated because, one, you don't feel it. You don't know that your blood pressure is elevated, right? You're not aware. It's easy to miss doses of medication, but high blood pressure is one of the factors that forces the cholesterol plaque into the arteries. And what I treat is heart disease from the standpoint of blocked arteries in the emergent situation. So if someone comes in with a heart attack, a clogged artery, I go in and do a procedure called angioplasty to open up the vessel, right? But sometimes, the best answer is the simplest answer, and it's preventative medicine. So that's why we try to start there with prevention. So one, knowing if you do have heart disease, because that is one of the factors that we're going to add to your risk profile. Number two is diabetes. What's the blood sugar? How have the blood sugar numbers been? What is your hemoglobin A1C? That factor is going to tell you what your blood sugars have been over the past 2 to 3 months. what does your cholesterol profile look like? Because when we look at a risk score, we have a risk calculator, and that risk calculator takes into effect, factors in male, female, heart, prior history of heart disease, hypertension, diabetes, high cholesterol, whether or not you smoke. So all those things in combination is going to build a picture in terms of predicting your risk. Now, there are other soft risks for heart disease that may go untreated, whether it's obesity, okay, something called metabolic syndrome, okay. And metabolic syndrome is kind of a smoldering low-grade diabetes, kind of pre-diabetes subset, obesity, and elevated cholesterol with somewhat of a mixed cholesterol picture. But that is something that we see, especially in the African-American community, okay? Because if you look at the numbers in terms of the percentage of African-Americans who are obese, that number is about 56%. It's significant compared to other races, whether it's Hispanics or white. So those are the things that we want to get ahead of. One additional is when we look at the cholesterol profile. We're all aware of good cholesterol and bad cholesterol. We want our bad cholesterol as low as possible, good cholesterol as high as possible. But when you look at those patients, and I see patients at 2 o'clock in the morning when someone comes in with a heart attack, I get called in and we go in and open up the artery. And I talk to the patient once we're done, and the patient says, "Doc, my cholesterol has always been good." 50% of people who have a heart attack actually have normal cholesterol profiles. So what we start to do and what we're seeing now is that there are additional inflammatory markers that will predict or have a great predictive value in terms of what your risk of heart disease is. Okay, whether it's a lipoprotein little a or high sensitivity C-reactive protein or ApoB. So from a cardiologist standpoint, we are screening patients for those lipid abnormalities when we see patients. We should all have at least a screen of that. And then also we'll talk more about a test called a calcium score, which is something that we want to make sure we all get. Anyone over 40 for sure. We want to make sure we get a calcium score.
Fantastic, outstanding information. Dr. Wingfield, I wonder if you could, just before we go to Dr. Plummer, so he can, speak to the ladies from their perspective on everything you just said. I wonder if you could briefly, can you share with everybody, let's assume that somebody's watching for the first time, and let's assume that somebody's not, they don't have primary care. So when we talk about these numbers, when we talk about cholesterol, when you say good cholesterol, bad cholesterol, anytime there's numbers, when you say diabetes, can you just give us a brief synopsis of what the ranges are and what are the good numbers and where are the numbers that people, start to get concerned and things of that nature?
Right. That's extremely important because when we look at, access to healthcare and how healthcare is delivered, the more insightful we are in terms of our numbers and what the expectations we should have from our physician, the better off we're going to be, right? So having an understanding of what your good cholesterol is, getting that cholesterol profile at least annually. If you're over 40, you want to get it at least every year. That good cholesterol, the thought is good cholesterol does help to clear out some of the plaque. Okay, so in males, that number should be above 40. In females, it should be above 50. In terms of our bad cholesterol, now there are different ranges of the bad cholesterol, which is your LDL. And that number is a moving target, is what I tell patients. Because if you're 40 years old with no medical problems, okay, your recommendation is going to be for your LDL to be less than 100. Okay. But if you have hypertension and diabetes, we're going to want to get that number, your LDL, less than 70. Now, if you've had a heart attack or you've had bypass surgery, we're actually driving that number down to 55. Okay. Now, if you've had multiple heart attacks or stroke or things of that nature, we want that LDL number to be less than 40. Okay. So we get more and more aggressive depending on the number of risk factors when it comes to heart disease. And as for those additional risk factors like that lipoprotein A, the ApoB, the high sensitivity CRP, those numbers also we look at, and their ranges that you could discuss with your physician.
Dr. Plummer, what can we share with the ladies based upon all the information we just heard? Obviously, they go through a lot, and so what are some things you can share so they'll understand as you come off mute, so we can hear everything that you're saying?
Well, one of the most important things is that they should follow up with a primary care doctor. A lot of women, they only go to the doctor when they become pregnant. Also, when they become pregnant and they have hypertension or preeclampsia, they're increased twice the risk of developing heart disease with later on in the future. Because sometimes pregnancy is a window into the future. Sometimes if they have preeclampsia or elevated blood pressure in pregnancy, they may have that. They're at increased risk of having that later on. The other factor that's also important in that is that women also present differently when they're having a heart attack compared to men. And so the whole important thing is to recognize if you're not really feeling very well, you have pain in your neck or pain in your shoulder or pain radiating down your back that's really unexplainable and something new, it's something to get evaluated, because not everyone is going to have what the classic Sanford and Son type of holding their chest and they feel that they're having a heart attack. It might be very, very subtle. So the important thing is to recognize it so they can go in and Dr. Wingfield can come in and save the day a little bit if they realize their symptoms of having a heart attack very, very early.
You see, Dr. Plummer, he tried to act like he was old school, talking about Sanford and Son.
Well,
he wasn't even born yet when Sanford and Son was on.
Everyone goes to the classic, grabbing their chest, and a lot of women have it more subtle, and that's the reason why still, heart disease is the #1 killer in women, because it goes undiagnosed. So that was, a little bit of levity, but it's still serious that, if they're not really feeling well or they don't feel out of sorts, to get evaluated.
This is powerful information, stuff that you're not going to find just anywhere. Go ahead, Dr. Wingfield.
One thing I will add to that is there was a big study that was done by the New England Journal of Medicine, and this was back maybe 2002, where it looks at essentially implicit bias in how African-American men, African-American women are treated differently when they present with the exact same symptoms as a white American, right? So they had 8 actors, all of which essentially read from the exact same script. Reading from that script, they identified classic anginal chest pain. Okay, so this is chest pain that a first-year medical student would determine is a heart attack. They gave the classic Levine sign, where you typically see a patient who's coming in with chest pain or having a heart attack. They'll clutch the chest and put their hand in a fist-like sign over the chest. They gave all the cues of someone having a heart attack. And what we saw is if you are a minority or even a woman, you had a 40% less chance of being triaged to a heart catheterization procedure. Okay. So as a white male, obviously, they were more likely to be triaged in the proper direction to undergo a cardiac catheterization. In minorities, African-American men and women, it was a 40% reduction in that referral. And for African-American women, it was a 60% reduction in that triage to the proper standard of care, presenting with the exact same diagnosis. So that's why recognition of the signs and physicians educating our patients as to, wow, this is not something I should be taking for, I should not be taking Motrin for because I'm having chest pain, or taking Tums or getting Rolaids or some sort of antacid because I'm having burning or heaviness in my chest.
So, Dr. Boykin, I wonder, hearing all this information about, heart, it's probably common for people to think about, we're talking about just the adults. And so certainly, obviously, we want to be mindful of our youth as well. Could you touch on the youth for us as far as, heart disease, heart awareness? Even though we're talking about youth, there's things we still need to be mindful of with our young people.
Absolutely. Dr. Wingfield and Dr. Plummer so adequately said, cholesterol is a problem in children as well as adults. Every child should have their cholesterol checked at least between the ages of 9 and 11 years old, and 17 to 21 years of age, they should have their cholesterol checked. And just like the adults, they need to have those numbers in the right numbers based on your age. So that's one aspect of it. The other aspect of it is that, you need to know your family history, because there are certain congenital heart disease that you can get. And if you don't know your family history, you can't prevent some of these things. I mean, not every congenital heart disease is preventable, I would admit, but there are certain things, such as, women should take it should be vaccinated against rubella, and they should also be mindful of having their diabetes well maintained, and their diet. So those are things that, thyroid disease. If you have thyroid disease, for example, you can have a baby that's what's considered microsomic, and that means a big baby. And those babies tend to have congenital heart. I'm not congenital, but they tend to have problems in the newborn period with their heart. The most common thing is what we call a ventricular septal defect. That's the most common congenital heart disease. But if you look at the numbers, about 1 out of 110 births has someone with congenital heart disease. So that's the thing you need to know about. Now, why is that important? Because you may have a certain type of congenital heart disease that will prohibit you from playing sports. And everybody wants, my son's got to be all district, my son's got to be all that. But if you don't know your family history and you have a sudden cardiac event, you could have a sudden cardiac event on the field, you need to know about those things. There are certain things that are left ventricular and right ventricular heart disease that lead to sudden death. I mean, I can't tell you the number of times in my practice I came in and the mother said, well, I saw my cardiologist today and they said that I have this, and so my child needs to be screened for that. Those are the ones that are aware, but how many of us don't know that? Because I don't think many people in the African-American community think, well, it's not going to happen to my child. My child's not going to have heart disease. That's the most erroneous thing to think, or for the adults, it can't happen to me. That's the most erroneous thing to think about. So children do have heart disease, and it starts out with, like I said, cholesterol. If you're obese, and we all know that children can be either type 1 or type 2 diabetics, and so that can lead to further disease as adults as well. So children are not prohibited from having heart disease. Your family history is the most important thing to know, because that's where you're going to determine what type of heart disease that may be prevalent in the family, or if I have something that is genetically determined, and if I marry someone else with genetically determined the same thing, how's it going to be for my children that I have in the future? So those are things you need to think about in the pediatric world. There's so many things about pediatric heart disease, but those are some of the main things you need to think about. Cholesterol is still an issue in the pediatric world, as well as obesity.
Interesting. Dr. Phillips, I wonder if you could shed some information for us. Let's talk about, the manliness of the men, right? We are rough, we are tough, we are strong. And so maybe we might feel something and we just think, I'll just shake it off. When do we, because you know how the fellas are, we rough and tough, we're not going to say that we got any pain. When do we get to the point where we need to say, hey, I need to pick up the phone, call my primary care, or maybe I need to call 911. Talk to us a little bit about things that people can experience and what they should do.
Well, again, I think, when we start talking about the manliness, I think one of the things, unfortunately, is the attitude that it won't happen to me. And unfortunately, a couple things that run in this same space is that we don't go to the doctor regularly. So again, we don't even know what our blood pressures are. And we may be walking around with a significant elevation in our blood pressure. In addition to that, there's a significant amount of us that are walking around with either diagnosed or undiagnosed high blood pressure, and we're not taking any medications for it. So we are already in a space that produces a significant amount of vulnerability when it comes to this condition. I mean, again, Dr. Wingfield mentioned it earlier. Say you have some of those symptoms, you take a Tums, it gets better. Okay, that may be a reason to relax, but I still think you should follow up in a primary care setting if you have alleviated the acute problem, just to make sure that it's not a bigger problem. However, if interventions that you're doing are not helping at all, or the symptoms are severe enough to cause you some concern, I think that in itself is reason enough to call 911, because unfortunately, I've unfortunately known a few people that have passed from heart attacks that have tried to drive themselves to the hospital in that manly way, and unfortunately didn't even die of the heart attack led to a motor vehicle accident where they ended up passing, but also hurting somebody else. So I think, again, if your basic, with chest pain, a lot of times when we're talking about chest pain associated with heart disease, it's called angina, and it's associated with exertion. So again, you could stop, and then if the chest pain goes away, that could be something that could put you at ease. However, again, that does not mean don't pay attention to it or follow it up later. And I think a lot of times that is a big problem. People go to a health fair, they go to a work or a doctor at their job, or have some type of interface with a medical provider or a health service, and the person says, hey, your blood pressure is a little elevated, you need to follow that up. That does not mean that, oh, well, I'm going to change how I'm eating, I'm going to exercise, and it'll be okay. You can do those things, and you should, but the other thing you need to do is to get your blood pressure checked. And a lot of times that comes in the form of checking in with your primary care physician, who will refer you, to Dr. Wingfield, so that you can, follow up and have even further testing, because you may need some more detailed testing than what I may provide in my office, which is an EKG. You may need an echocardiogram. You may need a stress test. All of these things that are helpful in coming to a conclusion of what the diagnosis is can be achieved with your cardiologist. However, the way most medical insurances work, you've got to get a referral to go see Dr. Wingfield. And if you don't have that, that would cost you a lot of money and probably prevent you from getting in to see him, unless you were to come in as an emergency room patient or you were admitted to the hospital. And I'm sure those are not the type of visits that you want to see him with.
Dr. Boykin, I think you want to chime in. Then Dr. Isabell, I want to go to you. Dr. Boykin?
Yeah, I just want to say there was a very important thing about, the manliness of it, because, as parents, we are our children's role models. So we don't want our young athletic males to go out there saying, well, my dad said I ain't got to worry about this, and then go out there and drop dead on the field. So I think it's a very, very important point that parents need to be the proper role model, in the sense, not only just for the male kids, but also for the female kids. That's a very, very important point that you brought up. And I just want to make sure that the parents understand that.
I just wanted to add one thing before we go to Dr. Isabell. Again, let's look at the most public heart, situations that have occurred with athletes. Hank Gathers, black male. Reggie Lewis, black male. You look at Damar Hamlin recently, black male. I'm not saying it exclusively happens with black men, but what I am saying, you look at in each of those situations, they didn't like the side effects, or the first two I mentioned, they opted to continue with the sport that was triggering their symptoms and opted against the medication treatment because they had problems with the side effects. And unfortunately, that short-sighted decision led to, two of those men. And I can remember, because I played basketball in college, watching Hank Gathers run right into the floor. I can remember, because I went to school in Baltimore, and Reggie Lewis went to Dunbar High School, was part of, some people say, the greatest high school basketball team ever. And I remember him fainting on the court when he was with the Boston Celtics. So, again, I know sometimes the things that we want to do may be interfered with when we pursue an answer or a solution to this situation. But now those two families, and then many more after that, that they don't have any man of the house anymore. That person's not here anymore. I'm sorry, Dr. Isabell. You go ahead, sir.
Yeah, Dr. Isabell, let's go ahead and chime on in.
Good evening. I'll start with, we mentioned those basketball players that passed away. They had what we call cardiomyopathy, enlarged heart. That could be congenital. It could be related to poorly controlled high blood pressure, but theirs were possibly more like congenital. It's where your heart is too large, too thick, where it goes into a non-sustaining arrhythmia where you cannot survive if you're not put back into that rhythm. In regards to coronary disease, hypertension, heart disease. The biggest thing that you have to also remember, smoking. Smoking is a big effect on heart disease, as well as we forget about mental illness and stress. That can also affect your well-being, as well as being not in good physical health regarding exercise. Other things that you may experience with heart disease, or if you have an event, some people get dyspnea, which we call shortness of breath, or they get extreme fatigue and they're so tired, and that could be a sign. So what is a good blood pressure? Depending on, there's different fellowships, different organizations, but everyone believe a good blood pressure is systolic, the top one, which is 120, is when your heart is beating and pumping, and the lower number, diastolic, 80. So good blood pressure is considered 120/80, and you should know what your blood pressure is. Then you go into pre-hypertension. Also depends on what some say. Pre-hypertension or elevated blood pressure is 130 to 139, or the lower number, the diastolic, 80. But some say 130 greater than 80 could be high blood pressure. But it depends on sometimes age or what organization, health group, because you have the American Heart Society, which had their own meaning of possible what is hypertension, and then you have what we use, the J and C. But everyone knows 140/90 is consistently as that has been around for years as hypertension. But if your systolic blood pressure is 180, that's critical. You need to call 911 or go to the emergency room, because that high risk of a stroke. And high blood pressure can also affect your kidneys, and also if you have bad kidney function, it can also cause you to have sudden death and heart issues, because it can throw your electrolytes out, your potassium, and that can cause you to have arrhythmias. So there's a lot of things. We go back to hypertension, and there's different types of heart disease, from enlarged heart, from coronary disease, and from valve disease.
Powerful information. Before we come to Dr. Wingfield, Dr. Plummer, let me just ask you, based upon the numbers we heard, same numbers for both male and female, maybe different numbers for females, or pretty much the same thing as you come off mute, and let us know. We just, for the ladies that's watching.
I mean, usually young women of reproductive age, there's a little bit more of a cardioprotective value to it, but still, just like cardiomyopathy, peripartum cardiomyopathy with women with high blood pressure, diabetes, obesity, smoking, that can be pretty fatal. So that's one of the things to also look out for. After they deliver, their heart muscle cannot handle the backflow of blood after the delivery, and their heart goes into heart failure. It can go into an arrhythmia, and that can cause sudden death. So one of the things is to know your blood pressure. If you're smoking, quit smoking. Keep your diabetes under control. When your diabetes is under control, when you become pregnant, it reduces the chances of developing congenital heart disease. So Dr. Boykin will make his life a lot easier with your diabetes control when you hand off those babies to him. So those are important things. But as I said again, it is still a number one killer in women. So it's not anything to take lightly. But as I said again, preventative medicine, know your values, control your blood pressure, control your diabetes, stop smoking, can help lengthen your life.
All right, before we go back to Dr. Wingfield, Dr. Isabell has a quick follow-up, and then I got a question for all the doctors before we go back to Dr. Wingfield. But Dr. Isabell, go ahead.
To add to Dr. Plummer's regarding what's good diabetic control, Ideal, we like what we call a hemoglobin A1C. It gives you an average over a couple of months of what your sugars should be. And the hemoglobin A1C, we usually like less than 7. How ideally, as you get elderly, the goal is to get someone less than 8 because we're concerned about certain age in the 60, 65 risk of too low sugars, which could put them at risk of falls. But we know if your hemoglobin A1C is greater than 8, you even have a higher risk of having complications or risk of diabetes. And that's what I wanted to add.
I just want to ask all the doctors, before we go back to Dr. Wingfield. Dr. Plummer said something interesting, and I'm just going to ask for, we know plenty of brothers, as it relates to that reference to no smoking, or stop smoking. And so can we just touch on briefly? I know we know a lot of people that, whether it's a cigar, whether it's cigarettes, when we say, are we talking once a month, once a week, or are we talking about people that are, in essence, chain smoking? Can you just touch on those that, are using tobacco products and the frequency and the potential impacts on their heart?
Yeah, I'll jump on that just because, I mean, the thing about tobacco abuse and cigarette smoking is it amplifies the damage to the vessels. Okay, so when you combine cigarette smoke along with diabetes, it's like, kerosene in a lighter, right? So it's just going to completely accelerate that process. And that's one thing that we see, especially in the Black community, is that we present a lot earlier with heart disease, okay, whether it's diabetes, hypertension, the onset is a lot earlier, whether it's 8 to 10 years prior to other races and ethnicities. So when you toss into the mix cigarette smoke, you're just going to accelerate that entire process and inflict even more damage on the arteries, as well as obviously the damage that it does to the lungs. So what's reasonable in terms of smoking? None, right? Because even casual or occasional smoking, one thing that most people miss, especially with cigar smoke, is erectile dysfunction, right? So men hear that, they say, yeah, it does. If you look at the numbers, it does increase the risk of erectile dysfunction. It's also doing more damage to the arteries throughout the body, whether it's in the brain, in the kidneys, in the heart, and it also drives up your blood pressure. So prior to smoking and after you smoke a cigarette, your blood pressure is elevated, right? So in our community, there's such a big genetic component when we deal with hypertension, right? 42% of African-American men above the age of 40 have high blood pressure, 44% of women, okay? Compared to other ethnicities, it's in the 20s to 30%, right? So we have a much higher incidence. Also diabetes, we look at the numbers. It's much more prevalent in our community. So we really have to be mindful of our diet, right? Minimizing salt, taking a look at how we eat and what we eat, the quote unquote, Southern diet or, soul food is something that we shouldn't be eating that anymore, right? It had its day and it had its time. But on a daily basis and a regular basis, in terms of the seasonings that we add to the food, it's just going to drive your blood pressure up. So that's just extremely important because, a lot of the stuff that we're doing, one analogy is kind of like, you got a faucet or you got a sink that's overflowing and the water's running into the sink. And what we do is we go grab a mop to mop up the floor, right? So you can actually fix this problem by turning off the faucet. Take a look at the diet. What are we taking in? What are we eating? How can I make some changes to improve my diet? Am I getting, 3 cups of vegetables a day? When we look at the numbers, we're not, right, as a community. So we really have to take a look at our diet, make adequate changes there, because just that component will significantly reduce our blood pressure, right? If we eliminate salt, our blood pressure can drop about 10 points. Right. And then the other aspect is medications. I see patients who will come to me for an evaluation, and sometimes they'll hear what they don't want to hear. That, look, you have high blood pressure. Your blood pressure is 150 over 100. you really need to start medication. All right, well, doc, well, look, I'm gonna join the gym. I'm gonna exercise. I'm gonna change my diet, and then you don't see them again, or they come back 6 months later and the blood pressure is even higher. So if all it takes is for you to take, one medicine, one tablet every day to fix your blood pressure, you need to do it, right? So you can join the gym and exercise and all those things while lowering your blood pressure. Because the last thing you want to do is be walking around with a blood pressure of 180 and then go to the gym and get on a treadmill and stroke out, right? We see what happens to us, Black males from the ages of 40 to 65. We every 6 months or so, we hear about one of us, and I know we all have friends and colleagues and people who we're close to who died or had massive strokes in that age range, right? Because of the other comorbidities that go untreated. In a lot of cases, we feel like, I don't feel any symptoms. I'm good. I can eat the same way I ate when I was 25. I don't have to exercise. I walk at work. So it's critically important that we approach our health in multiple different facets, whether it's nutrition, diet, exercise, and medication.
Dr. Wingfield, let me ask you this, because I know the people that are watching, I know at least one person, if not two, are wondering. So when we talk about, or when you mention, change of diet, we got to, change the way we do things. Are you suggesting that it's a complete stoppage, or just not as much? When we say change our diet, are we talking about and I don't want to pick one piece of food in particular, but if there's something that's not good for us but we love,
Right.
Are we saying take it out completely, or are you just saying in moderation? Talk so you don't break too many hearts tonight.
Okay, well, one thing I will say is that we have to increase vegetables, right? How many of us get the recommended 3 cups of vegetables a day? Are we getting that? Is that part of our diet? If you look at the overall best diet with the best overall outcomes, it's going to be geared towards more of a plant-based diet, right? But that's difficult, right? It's difficult to just go all plant-based. But if we could, minimize red meat, okay, that's a good place to start. And then when you say that, patients say, well, I don't eat red meat. Okay, well, lean chicken and fish. How do you prepare your foods, right? Is it primarily fried? You have to eliminate nothing fried. Fast food, you really have to eliminate fast food, because the salt content in that is so high that that's going to jack up your blood pressure, right? So it is more thought behind your meals, increasing the vegetables, increasing the whole grains, nuts, almonds, cold water fish, right? Because cold water fish has that omega-3 fatty acid, that healthy fish oil in salmon, halibut, cod, trout, tuna, those would be the fish that you want to incorporate into your diet 2 to 3 times a week, right? So it is getting a more leaner diet and also minimizing the carbs. The carbs in the diet gets converted into sugars, and that is going to cause weight gain, and then also is going to cause your diabetes or your blood sugars to be elevated.
One of the things is that we also need to change our whole social aspect, because, as I said, those meals are really great, but it's very expensive. And a lot of people will have to now try to budget, might have to hold back on some things now to try to eat a lot better, because eating better is a lot more expensive than it is, buying processed and salty foods. So that is another thing. It's a part of a culture that we're also trying to kind of, cultivate and also kind of change for the better.
I just want to add to that, Dr. Wingfield and Dr. Plummer are absolutely right. But one aspect of carbs we have to remember that they're good carbs or bad carbs. We can't completely eliminate all carbs from our diet, but you just got to use. I always taught my patients, even my young 10-year-olds and things, that become a label reader. If you can read the label on there, it says it has added sugars. That's a bad carb for you. Put that one down. Put that one down. Also, if you have a significant amount of fiber in there, that could sometimes decrease the amount of carbs in. So there are good carbs in there, but you got to know what you're doing. You know, you have to change your thought process. You know, you can't eat. You can find a lot of things from reading the label. You know, the sodium content of most foods are going to be on your package. And unfortunately, all the healthy foods for us, as Dr. Plummer already said, cost more than the snack foods and the fast foods. But, you know, we got to figure out a compromise somewhere along the way, because if not, you're going to end up seeing Dr. Wingfield at 2 o'clock in the morning with clogged arteries.
Yeah. And one thing to incorporate is even the breakfast. Whether you do the intermittent fasting where you don't eat until 12 and you only eat between 12 and 8 p.m., there's a lot of data going towards that aspect.
Yes.
But eating things like oatmeal in the morning, yogurt, okay, Greek yogurt, those things are going to be much more beneficial from the standpoint of oatmeal. Oatmeal binds the cholesterol in the gut and helps you eliminate and lower your cholesterol. Cheerios, oat-based foods. So in terms of, you know, grabbing that bacon, egg, and cheese, or going by McDonald's and getting, you know, sausage, egg, muffin, it's just, you can't do it. How long is that sustainable? It's just not. You have to make some intentional changes in your diet. And yeah, this is not saying you can't go to wherever, you know, McDonald's, Popeyes, or things of that nature. But you really have to be intentional about what you eat, how you eat, and look at your diet, breakfast, lunch, and just think about what you're doing when you're eating and what you're eating.
88.
Well, you know, just a couple things to add to what the brothers have already said that are very correct. Portion control. Unfortunately, a lot of us are conditioned to overeat. I mean, how many of us are heard, do you know that there's kids someplace else in the world that don't get any food and you leaving food on your plate? We look at how the meal size, if you do buy fast food, how the size of the portions have increased over the years. So that's one significant aspect that we have to be mindful of, because those portions can definitely lead us to overeat and lead us in an unhealthy direction. In addition to that, the time of day that we eat. You know, we look at heart disease is a big problem in the United States of America. A lot of us tend to eat our biggest meal after work. Now, you go to Europe, their biggest meal is lunch. So by the end of the day, they've digested and utilized their big meal of the day. Whereas what do we do after we eat dinner? I'm going to go lay down and watch some TV. And what happens? That food is right there, and it's going to go to all the wrong places. The last thing I would mention nutritionally is caution with sweetened drinks. You know, people, oh, well, I just drink cranberry juice. Ocean Spray cranberry juice has an incredibly large amount of sugar in it. In addition to that, sodas, and not drinking enough water. So those are some additional things that are just style things that can make a big difference in our food impact on us. So I just wanted to add that.
Dr. Isabell, go ahead.
I just want to add alcohol consumption. Some say a glass of red wine can do with the antioxidant could help the heart, but I'm talking about over drinking alcohol because it can have a negative effect. It can raise your cholesterol. It can enlarge your heart. Not only affect your liver, it can affect other organs. So overzealous with alcohol is also a cardiac risk factor.
And unfortunately, Dr. Isabell, I think people will take away, he did say a glass of red wine a day.
No more liquor.
We got about 10 minutes left. Let me Dr. Wingfield, since it's heart awareness, earlier in the program you mentioned briefly, you talked about blockage. I'm wondering if you can just because obviously people hear different things. One of the things that I've heard, which I thought was interesting, is a cardiologist said everybody has a certain amount of blockage, and so it's the matter of how much blockage you have. Can you speak to that? Does that make sense? Does that not make sense? Any
Right. Yeah.
Educate us on blockage so we understand.
Okay.
Yeah.
So what we're talking about in terms of blockage is we're talking about cholesterol. We all have seen our cholesterol profile, but that cholesterol is what's circulating in the blood. That cholesterol, or that which is cholesterol, sticks to the artery.
Let me check. Is it me or?
No, we're having some technical
On
difficulties.
Dr. Wingfield? Okay.
While he's coming back
Yeah,
on,
go
I
ahead.
just want to add a couple of things. We talked about smoking and alcohol. Those are two things that are at high risk for congenital heart disease too. Fetal alcohol syndrome and smoking are two bad things. So if you're pregnant, don't drink and don't smoke.
All right. Sounds good. I think we got Dr. Wingfield back. Dr. Wingfield,
you
you want to try it again?
Yeah, we got some.
Okay.
Yeah, but what happens is that cholesterol sticks to the arteries, clogs them. Now, one thing that we really push for is a test called a coronary calcium score, which is a CAT scan of the heart, and that CAT scan is going to quantify how much plaque or cholesterol has built up in the arteries. You get a number, okay? So that CAT scan takes about 3 minutes total. Okay, it's very quick. And it's going to calculate how many particles of calcium, which is cholesterol, has built up. Any score above 0 is abnormal. Okay. Now, as we get older, yeah, we tend to have a little bit of plaque, but the ideal score is a score 0. There's a 10-year predictor, calcium score of 0, that your risk of having a heart attack or heart disease is less than 5%. Okay, so we recommend, and I order all my patients. I made sure my mom and dad had a calcium score. So you need to get that calcium score. Now, what do we do with it? If that calcium score is above 100, automatic. You're taking aspirin every day, okay, because you have that amount of plaque built up in the arteries. Still in the mild range, but the higher that number, the more plaque is built up, and the higher your risk of having an event, whether it's a heart attack or a stroke. Now, if that calcium score is abnormal, we also recommend that you get a carotid ultrasound, which is an ultrasound of the arteries here in the neck, because anytime you say heart attack, you tend to hear stroke, okay, because they will go hand in hand. So you want to get screening for that. Number 2 is if you do have an elevated calcium score or cholesterol in the artery score, then we want, obviously, for you to make some dietary changes. Medications are very likely to be recommended, depending on how high that calcium score. Because if you're 46 and you have a calcium score of 78, that's equivalent to someone who is, 76 years old. So there is kind of a age quantification where if you're 45, we expect you to have a calcium score of 0. If you're 78 and you got a calcium score of 40, 50, so you have to really look at your numbers and compare those numbers with, or sit down with your physician and have a discussion. So I do recommend that you get that calcium score to evaluate how much plaque is built up in the arteries. Anybody over 40, for sure, get a calcium score. They are not covered by your insurance. Okay, depending on where you are, we've actually driven down the cost to $50 at my hospital. So it's $50 for that calcium score. Other places it can be as much as $100 to $150 for that calcium score, but it is money well spent.
I wonder if I could, Dr. Wingfield. I know it's fairly recent. As things change, I want to go back to, we were talking about tobacco and smoking, how that impacts the heart. Is there any information, is there any research as it relates to vaping? I know that's the new thing that has come out. So do we have any data as of yet as it relates to vaping and the impacts on the heart from vaping?
Well, we do know about vape-related lung injury, right? So there is definitely lung injury related to vaping. The purification or purity, you really just don't know what you're ingesting into your body. The carcinogens all inflict damage on the arteries. So what you're doing is making these micro perforations or micro damages to the arteries, and that is going to just accelerate that process. So in terms of, direct correlation, it is presumed that it is unhealthy. You're not going to find a cardiologist that's going to endorse vaping and say that you're doing better vaping. We tend to tell patients, no, it's as bad as cigarette smoking. So.
Okay, there it is. Well, we have again come to that point of the show where it's just so much information, and it's so much good information. That's just how fast the time goes. So let's go now to our segment where we will have a 1-minute closing from each of you. As always, to the doctors, the community, we thank you for sharing this information, and we look forward to seeing everybody next month. So let's have a 1-minute closing from everybody. Let's start from Dr. Plummer. If you could give us your 1-minute closing as we prepare for next month.
Well, good evening. Thank you for letting us into your computer so we can talk to you about better health. I just wanted to make sure that we emphasize prevention. I want to emphasize for the ladies, for them to find, their primary care provider, and not rely so much on their obstetrician or gynecologist for all of their medical care, because we're not trained, especially in a lot of primary care and preventative medicine. So I just wanted to make sure, get your diabetes under control, stop smoking, know your blood pressure, and know your history. And good night.
Dr. Plummer, as always, we appreciate you. Thank you so much for joining and sharing that information, and looking forward to some updates again next month. Let's go to Dr. Isabell.
Good evening. Once again, thank you for having me here. Preventive measures to prevent heart disease, most important. And I mentioned smoking again, because smoking, no matter how much you smoke a week, but you have to stop completely, because what does smoking do? It affects the lungs. And what do we need to survive? We need oxygen. So if your lungs are not working well, that can put a stress on your heart, because think of the supply and demand. The demand may be there, but the oxygen is not there. And stress causes inflammation to the heart, to the arteries, and puts you at risk of heart disease, a heart attack, or even a stroke. And also your heart sometimes has to work harder. If it works too hard, it gets too enlarged. Also, be aware there's other less common things that can contribute to heart disease. What we see, I didn't mention before, is ADD, Adderall. Adderall is used a lot, especially during times of COVID, but even before. But the long-term effect Adderall does, it makes the heart beat too fast. And when the heart beats too fast, it gets too thick. So 10, 15 years, 20 years, you can develop heart problems. But once again, preventive measures and other factors are involved. Thank you.
Thank you so much, Dr. Isabell. Let's go to Dr. Wingfield, man of the hour tonight.
Okay, thank you everyone for joining this program. Hopefully it was insightful, and we have kind of enlightened you and triggered you to make some dietary changes, some overall changes in general. So the key things that we really wanted to drive home is prevalence, especially in the Black community, in terms of hypertension, diabetes, smoking, obesity. Those things are far more common in our community. And one way to get around and to treat all of those, first and foremost, is that we have control, right? We can control what we put into our bodies in terms of our diet, our nutrition, and eating properly, and managing our diet in such a way that we can treat our diabetes, we can treat our hypertension. Exercise. The recommendation in terms of exercise from the American Heart Association is actually 150 minutes of exercise a week, right? So it's one of those things where we have to do dedicated exercise, whether it's 20-minute walk or the 30-minute on the treadmill. We have to dedicate ourselves and our time to exercise our bodies. We can't say, well, I walk at work, or I walk to the bus, or I walk here or there. It has to be dedicated time where we actually, sweat. You have to exercise the heart in order for to reap the benefits from a heart disease standpoint. Knowing your numbers, extremely important, whether it's your blood pressure, your hemoglobin A1C for your diabetes, your cholesterol, all of those risk factors. You have to know what your numbers are and actually take initiative and actually treat those, whether it's with medication, which if it's recommended, we are far less likely to follow through with the recommendation to take a medication or start a medication. So we have to be mindful that, all medication is not a bad thing. It doesn't mean that we're weak or it has side effects. See if it has side effects that actually affect you. But the worst thing you can do is walk around with blood pressure being significantly elevated and then end up with a stroke or something even worse. Okay. So finally, seeing a primary care physician. And who needs to see a cardiologist? Anyone with hypertension, anyone with diabetes, anyone with at least one risk factor for heart disease should see a cardiologist. So thank you all for watching and listening in, and look forward to next month's program.
Outstanding. Thank you so much, Dr. Wingfield. Let's go to Dr. Boykin.
Well, thank you so much. I hope everyone enjoyed this program. It was a lot of information given out, and I learned a lot from this program as well. But you've heard all the other doctors say, talk about exercise and diet. These are things that we do in the pediatric world to prevent adult heart disease. So what you as a family can do for your child is, first of all, be a role model. They see and mimic your behavior, and their behavior will be your behavior that you inflict upon them will be carried through as adults. Have your child exercise regularly. No child should be sitting around on the couch watching TV or playing video games. They need to exercise. Make sure they have a healthy diet. And most importantly, know the family history, because there are things in the family history that may predispose to congenital heart disease, or maybe have a silent congenital heart disease that you don't know until it's too late, such as being out in the field of exercise. If you are pregnant, please don't smoke and please don't drink alcohol. See your OBGYN and your primary care physician regularly. And most of all, invite your friends to come out and listen to these programs we give on a monthly basis, because a lot of information that we give is geared toward our community in preventative health. Thank you and have a good night.
As always, we thank you, Dr. Boykin. We appreciate you. And last and certainly not least, our chairman of this committee, Dr. Jedan Phillips.
Well, thank you, everyone, for your attention tonight. Thank you to my brothers for participating in this very information-filled conversation. Dr. Wingfield, thank you for leading us. Again, I think, as we've tried to do every month, is to emphasize the importance of taking a preventive approach with your health. Again, when we talk about heart health and the numbers that are not good when it comes to as a community, our heart-related issues, we can unfortunately draw a direct correlation to why COVID had affected our communities so tremendously. So again, I know we're out of the pandemic now, even though people are still getting COVID, but if we were to have another problem similar, again, heart disease is a major risk factor. So again, what I would say to you is take that preventive approach, make that appointment with your doctor, follow up on those tests, make sure you're taking your medications regularly, make sure that you're trying to avoid toxic habits that can have a negative effect on you. Make sure that you are exercising regularly. So again, take all this information, and how do you input it into your own life so that you can start to benefit from it? And see us next month, 4th Wednesday in the month. We're going to have yet another topic to deal with, another preventive health issue. And we really are excited about the future talks that we have. So please come on and join us. Invite people. Our talks are open to the general public. So with that, I thank you for your time. Brother Immediate Past, we could have no better moderator than you, my brother. So thank you so much.
Well, Dr. Phillips, it's just a pleasure to be here with all of you. Each and every month, we get an opportunity to dwell together in unity. It's an opportunity not only to dwell together, but most importantly, it's an opportunity to learn something. As always, I want to say thank you to all of you who take the time to watch and gather this information. Certainly, thank you to our doctors who take time out of their busy day to make sure that we, the community, we are uplifted with this very critical and very much needed information. Certainly, as you heard from the committee chair, Dr. Phillips, on next month, yet another topic, and we are excited. You'll have to come back and visit us to see what that topic is, but I promise you, we're going to have a very special guest and some very special presenters on next month. So stay tuned. As always, please make sure that you schedule time to donate blood. It is imperative. It is important. So I always stress that you take the time, schedule it, help save a life, and give the gift of blood. Until next month, stay well and be well.